Hello, everybody, and welcome to our Medicare 101 presented by Connie Health. Thank you for joining us today. My name is Sid Martinez. I am a licensed agent and general manager at Connie Health. Have over 11 years of Medicare experience helping many folks such as yourself navigate through their Medicare benefits. I'm looking forward to using that knowledge today to help answer your questions. A little bit about Connie Health. Connie Health is a no-cost service that gives you unbiased recommendations from local licensed agents. We use advanced technology to sort through your plan options to find the one with the doctors and medications you need and care about, okay? You're actually paired with the local licensed experts who's available to answer all your questions and guide you through the Medicare process. Plus, once enrolled in the plan, you have access to a local Medicare care team that can help you find doctors and specialists and explain your plan benefits. Today, I'll be sharing an overview of Medicare, your Medicare 101, and at the end of the presentation, you'll know when and how to apply for Medicare and your Medicare options. If you have specific questions, you can submit them in the chat box and I'll be shared directly with me. And we'll have time at the end for some Q&A. You can speak to a licensed agent at any time by calling 1-888-878-6064. That's 1-888-878-6064. And we'll share that number again in case you missed it. All right, well, let's go ahead and get started. So welcome to Medicare. Medicare currently provides health insurance for 62 million people in the US who are 65 and older or are under 65 with certain disabilities who have been entitled to Social Security Disability Income or SSDI benefits for at least 24 months. And that includes folks that have conditions such as ALS or end-stage renal disease. Medicare is also available to a very small subset of people who have asbestos-related conditions associated with a federally declared environmental health hazard. Currently, it only applies to people affected by a hazard in Libby, Montana. So what agencies are responsible for Medicare? Social Security is responsible for enrolling most people in Medicare. The Railroad Retirement Board is responsible for enrolling railroad retirees in Medicare. Social Security and the Railroad Retirement Board are responsible for Social Security and the Railroad Retirement Board also collect and determine the amounts of Part A if you have to buy it and Part B premiums. Medicare uses the name and addresses you have on file with Social Security. To change your name and or address, visit your online My Social Security account at socialsecurity.gov/myaccount. If you're retired from the federal service, contact the Office of Personnel Management, OPM, at opm.gov regarding your premiums. Medicare coverage and benefits and payments are administered by the Centers for Medicare and Medicaid Services, also known as CMS. So automatic enrollment for Part A and Part B. If you're already getting Social Security or railroad retirement benefits during your initial enrollment period, known as the IEP, you will automatically be enrolled in Part A and Part B. You'll get your Welcome to Medicare package, which includes your Medicare card and other information, usually about 3 months before you turn 65, and coverage begins the first day of the month you turn 65. If you're under 65 and have a disability, you'll automatically get Part A and Part B after you get disability benefits from Social Security for certain disability benefits from the Railroad Retirement Board for 24 months. You will get your Welcome to Medicare package, which includes your Medicare card and other information, again, about 3 months before your 25th month of disability benefits. And the coverage begins your 25th month of disability benefits. A quick note here, if your birthday is the first day of the month, your coverage begins the first day of the month before your 65th month birthday. And if you aren't getting retirement benefits from Social Security or Railroad Retirement Board, you must sign up to get Medicare. So this is your Medicare card. If you're an original Medicare, you use your red, white, and blue Medicare card when you get healthcare services. If you join a Medicare Advantage plan, you may give your card to use when you get your healthcare services and supplies. Your Medicare Advantage plan ID card is your main card for insurance, okay? The Medicare card shows the type of coverage that you have, Part A, Part B, and have the date your coverage started. Your card has a Medicare number that's unique to you. It's a unique combination of letters and numbers, and this helps to protect your identity. If you get your Medicare card and don't want Part B, you follow the directions and return the card. Medicare will send you another card that shows you only have Part A coverage. Only give your Medicare number to doctors, pharmacists, and other healthcare providers, your insurers, or people you trust to work with Medicare on your behalf. If you forget your card, you, your doctor, or other healthcare providers may be able to look up your Medicare number online by using the secure Medicare Administrative Contractor portal. You may also get your Medicare number by signing into your Medicare account on mymedicare.gov and print an official copy. So some people must take action to enroll in Medicare. If you aren't getting Social Security or railroad retirement benefits at least 4 months before you turn 65, you will need to sign up for Part A, even if you're eligible to get Part A premium for free and Part B. To avoid a delay in coverage, you should contact Social Security to apply for Medicare 3 months before you turn 65. If you work for a railroad, contact the Railroad Retirement Board to sign up. You do not have to be retired to get Medicare. You can enroll online at socialsecurity.gov or call 1-800-722-1213 or make an appointment at your local Social Security office. I do want to mention also, we can help you and send you information that you need by just giving us a quick call and speaking to one of our licensed agents. So some decisions to make here. Do you need to sign up for Part A? If you're getting Social Security or Railroad Retirement Board benefits at least 4 months before you turn 65, you will automatically be enrolled in premium-free Part A. If you don't get Part A automatically, you should consider signing up for Part A when you're first eligible, which is during your initial enrollment period, your IEP. Most people don't pay a monthly premium for Part A coverage because they or their spouse paid Medicare taxes while working. If you aren't eligible for premium-free Part A and you don't buy it when you're first eligible, your monthly premium may go up by 10%. You'll have to pay the higher premiums for twice the number of years you could have had Part A but didn't sign up. The Part A late enrollment penalty applies after 12 months have elapsed from the last day of the IEP to the last date of the enrollment period you used to enroll. In other words, if it's less than 12 months, the penalty won't apply. This penalty also won't apply to you if you're eligible for a special enrollment period. Remember, you're only eligible for an SEP when first eligible for Medicare. If you or your spouse or family member, if you're disabled, is actively working and is covered by a group health plan, also known as a GHP, through the employer or union based on that work, or during the 8th month period that begins the month after the employment ends or the GHP coverage ends, whichever happens first. If you're still working or have coverage through a spouse, talk to your employer benefits coordinator to learn how enrolling on Medicare or delaying enrollment will affect your employer coverage. Another quick note here, you can no longer contribute to a health savings account, HSA, if you have Medicare. Make sure you talk to your company's benefit administrator about when you should stop contributing to an HSA account. Again, to avoid Internal Revenue Service tax penalties, stop contributions to your health savings account before your Medicare starts. Another decision, should I keep or sign up for Part B? If you're already getting Social Security benefits, and you'll automatically be enrolled in Part A and Part B. You'll get your Welcome to Medicare package, which includes your Medicare card and other information about 3 months before you turn 65, or 3 months before your 25th month of disability benefits. The Part B premium is usually deducted from your Social Security or railroad retirement or federal retirement payments. The amount depends on your income and when you enroll in Part B. If you delay the enrollment, you may have to pay a lifetime penalty, which is added to your monthly Part B premium. People who don't get a retirement payment or whose payment isn't enough to cover their premium will get a bill from Medicare for their Part B premiums. The bill can be paid online by credit card or debit card from your checking or savings account through your bank's online bill payment services or through Medicare's Easy Pay or by check, money order, or other credit card or debit card. Having the employer or union group health plan coverage while you or your spouse is still working can affect your Part B enrollment rights. This includes federal and state employment and TRICARE active duty military service. You should contact your employer or union benefits administrator to find out how your insurance works and your Medicare, and if you should enroll in Part B during your IEP. There are certain situations where you must have Part B. When you must have Part A and Part B. You must have Part A and Part B if you want to buy a Medicare Supplement insurance policy, also known as a Medigap, if you want to join a Medicare Advantage plan, if you're eligible for TRICARE for Life or CHAMP VA, Civilian Health and Medical Program for the Department of Veterans. TRICARE for Life provides expanded medical coverage to Medicare eligible uniform services retirees 65 or older, to their eligible family members and survivors, and to certain former spouses. Your employer coverage requires you or your spouse, family member to have it. Fewer than 20 employees. Talk to your employer or union benefits administrator. Veteran Affairs or VA benefits are separate from Medicare. With VA benefits, you may choose to enroll in a Part B, but you pay a penalty if you don't sign up for Part B during your IEP and enroll later. If you have VA coverage, you won't be eligible to enroll in Part B using a special election period. Quick note here, if you have other coverage, you need to find out who pays first, and you can find out at medicare.gov as well. Another quick note regarding Veteran Affairs or VA benefits, they are separate from Medicare. With VA benefits, you may choose not to enroll in Part B, but you pay a penalty if you don't sign up for Part B during your IEP and later enroll later. If you have VA coverage, you won't be eligible to enroll in Part B using the special election period. What you pay your 2022 Part B premium. The monthly Part B premium will be deducted automatically from your Social Security benefit payment when your coverage starts. If your Social Security benefits aren't enough to cover the whole Part B premium, or you stop getting Social Security benefits, you'll get a bill for your Part B premium every 3 months. The monthly Part B standard premium is $170.10 this year in 2022. Remember, this premium may be higher if you didn't choose Part B when you first became eligible. The cost of Part B may go up 10% for each 12-month period you could have had Part B but didn't take it. In most cases, if you don't sign up for Part B when you're first eligible, you may have a delay in getting Medicare coverage in the future, and you may have to pay a late enrollment penalty for as long as you have Part B. You'll pay the standard premium or higher in 2022 if you enroll in Part B for the first time in 2022, don't get Social Security benefits, are directly billed for your Medicare Part B premiums, have Medicare and Medicaid pays your premiums, which is where your state will pay the standard premium amount of $170.10 this year. When you can sign up for Medicare. If you don't have Medicare and you're eligible for premium-free Part A, you can enroll in Part A anytime you're eligible. Your coverage will begin up to 6 months back from when you apply, but won't start earlier than when you were first eligible for Medicare. However, you can enroll in Part B and Part A if you have to buy it only during specific enrollment periods. Generally, your first opportunity to enroll is during your initial enrollment period, the IEP. If you don't enroll in Medicare during your IEP, or if you don't enroll in Part B during your IEP, you have to wait until the next general enrollment period, the GEP. After your IEP is over, you may have a chance to sign up for Medicare during the special enrollment, special election period. If you already have Medicare, you can make changes to your coverage during the yearly open enrollment period or annual enrollment period, the Medicare Advantage open enrollment period, or a 5-star enrollment period, or in certain circumstances during special election periods. Enrolling in Medicare or changing how you get your Medicare are important decisions. They must be done timely to avoid late enrollment penalties and to be sure you get coverage you need when you need it. These enrollment periods are explained later on. So what is the initial enrollment period, the IEP that we keep talking about? This is your first opportunity to enroll in Medicare during your IEP, which is the 7th month period that begins 3 months before your month you turn 65. Your coverage starts based on when you enroll. If you enroll during the first 3 months of your initial enrollment period, your coverage will begin the first day of the month you turn 65. If your birthday is the first of the month, coverage begins on the first of the month before you turn 65. If you enroll the month you turn 65, your coverage will begin the first day of the next month. If you enroll in the last 3 months of your IEP, your Part A and Part B coverage will be delayed 2 or 3 months. If you're eligible for premium-free Part A, you can enroll in Part A once your IEP begins and any month afterward. If you have to buy Part A and or B, you can only sign up during a valid enrollment period. If you don't enroll in Part B during your IEP, you may have to pay a late enrollment penalty. For Part B, it's a lifetime penalty. A quick note, your 6-month Medigap OEP starts when you are both 65 and have Part B. Special enrollment periods, or SEPs. If you or your spouse are still working and have group health plans, or a GHP, which is a health plan offered by an employer or employee organization that provides health coverage to their employees and their families, and you didn't sign up for Part B or Part A if you had to buy it during your IEP, you may be able to enroll during a special election period. A special election period allows you to enroll after your IEP and not wait for the general election period. If eligible, you usually don't have to pay a late enrollment penalty, but this SEP is limited. If you're 65 or older, the GHP coverage must be based on your spouse's active or current employment. If you have Medicare based on a disability, you can also have a GHP coverage based on a family member's current employment. It's important to note that COBRA, which is short for Consolidated Omnibus Budget Reconciliation Act coverage, retiree coverage, or long-term workers' compensation and veteran affairs coverage for VA, they are not considered to be from active or current employment. You can sign up for Part A or Part B anytime you're still covered by a GHP during the 8-month period that begins the month after the employment ends or the coverage ends, whichever happens first. If you don't enroll in Medicare within the 8-month special election period, you'll have to wait until the next general election period to enroll, and you'll have a gap in your coverage and you may have to pay a penalty. The special election period doesn't apply to people who are eligible for Medicare based on end-stage renal disease. It also doesn't apply if you're still in your IEP. If you have Medicare Part A but delayed Part B, your Medigap OEP starts when your Part B coverage starts. You can buy a Medigap policy during the 6 months after your Part B effective date. You must have Part A and Part B to buy a Medigap policy. Quick note here, if you have a disability and the GHP coverage is based on the current employment of a family member, the employer offering the GHP must have 100 or more employees for you to get a special election period. What is the general enrollment period, or GEP? If you didn't sign up for Part B or Part A, or Part A if you have to buy it during your IEP and you don't qualify for a special election period, you can enroll during the general enrollment period, or the GEP. For most people who don't enroll during their IEP or SEP, this is their only chance to enroll. The GEP occurs each year. It begins January 1st and ends March 31st each year. If you enroll during the general election period, your coverage will start on July 1st. This is required by law. In addition, if more than 12 months have passed since you were eligible for Part A or Part A if you have to buy it, you'll likely have to pay a late enrollment penalty that's added to your monthly Part B premium, or Part A if you had to buy it. In most cases, you'll have to pay this penalty for as long as you have Part B. However, if you delayed your Part B or Part A and you had to buy it because you or your spouse were still working and had a GHP coverage, you won't have a late enrollment penalty, and you may be able to enroll during a special election period. The SEP will be discussed in more detail later. If you delayed your enrollment in Part B, you must complete and submit the application for enrollment in Medicare Part B from the Centers for Medicare Services. To sign up for the Part B general enrollment period package is sent to those who didn't sign up, dropped, or lost Part B in the past year. The package notifies people of the chance to enroll in Part B during the general enrollment period. It includes a letter and booklet. The package explains how to sign up for Part B, the risk of delaying enrollment, and other decisions you may need to make about your Medicare coverage. If you aren't eligible for premium-free Part A and you don't buy it when you're first eligible, your monthly premium may go up 10%, and you'll have to pay higher premiums for twice the number of years you could have had Part A but didn't sign up. This means your monthly premiums will be higher than if you signed up during your initial election period. The longer you go without coverage, the longer you must pay the penalty. So what are the parts of Medicare? The parts of Medicare include your hospital Part A insurance, Part B is your medical insurance, Part D is your prescription drug coverage, and also included with Medicare are Medigap or Medicare Supplements, and Part C, also known as Medicare Advantage plans. What does Part A cover? Part A, hospital insurance, helps cover medically necessary inpatient services, such as inpatient hospital care, which includes semi-private rooms, meals, general nursing, and any medications you may be taking. Part A also covers other things such as blood. If the hospital gets blood from a blood bank at no charge, you won't have to pay for it or replace it. If the hospital has to buy blood for you, you must either pay the hospital cost for the first 3 units of blood and you'll get it in a calendar year, or have the blood donated by somebody else. It also covers hospice care and home health care. So paying for Part A. You usually don't pay a monthly premium for Part A coverage if you or your spouse paid enough Medicare taxes while working. This is sometimes called premium-free Part A. The Federal Insurance Contributions Act, also known as FICA tax, is a U.S. federal payroll or employment tax imposed on both employees and employers to help fund Social Security and Medicare. About 99% of people with Medicare don't pay Part A premiums since they've worked at least 40 quarters or 10 years of Medicare covered employment. Enrollees 65 and over and certain persons with disabilities who have fewer than 40 quarters of coverage pay a monthly premium to get coverage under Part A, unless they can get benefits through a spouse or family member's record. If you aren't eligible for premium-free Part A, you may be able to buy Part A if you're 65 or older and you've enrolled or are enrolling in Part B and meet the citizenship and 5-year residency requirements. If you're under 65 and have a disability and your premium-free Part A coverage ended because you return to work, or if you're under 65 and have a disability, you may continue to get premium-free Part A for up to 8.5 years after you return to work. In most cases, if you choose to buy Part A, you must also have Part B and pay monthly premiums for both. The amount of Part A premium depends on how long you or your spouse worked in Medicare covered employment. If you aren't eligible for premium for Part A and you don't buy it when you're first eligible, your monthly premium may go up 10% for every 12 months you didn't have the coverage. You'll have to pay the higher premiums for twice the number of years that you could have had Part A, but you didn't sign up. So Part A, what you pay. The actual dollar amounts are updated yearly. To see the most current amounts, you can also visit Medicare.gov. But this is what you pay per benefit period for Part A covered medically necessary services. For a hospital inpatient stay, after you pay the deductible of $1,556 for 2022, you pay no coinsurance for days 1 through 60. For days 61 through 90, you have a copay of $389 per day. And for days 61 through 90, you pay $778 for each coinsurance per each lifetime reserve day for days 91 and beyond. Each benefit period up to 60 days over your lifetime, all costs for each day beyond lifetime reserve days. Similarly, with mental health inpatient stay. A quick note to note is that there's no limit on the number of benefit periods you can have when you get mental health care in a general hospital. You can also have multiple benefit periods when you get care in a psychiatric hospital. Remember, there's a lifetime limit of 190 days. So continuing with Part A and what you pay here. So for skilled nursing facility, you pay $0 for the first 20 days of each benefit period. You pay $194.50 per day for days 21 through 100 for each benefit period, and you have to pay all costs after day 100. As far as home health care services, you pay $0 for home health care services, but you pay 20% of the Medicare approved amount for durable medical equipment. Durable medical equipment are things like wheelchairs and walkers, for example. Part A also includes hospice care. You pay $0 for hospice care and up to $5 per prescription to manage pain and symptoms while at home. 5% of Medicare approved amount for inpatient respite care. Medicare doesn't cover room and board when you get hospice care in your home or other facility where you live, like a nursing home, for example. When it comes to blood, if the hospital gets blood from a blood bank at no charge, you won't have to pay for it or replace it. If the hospital has to buy blood for you, you must either pay the hospital cost for the first 3 units of blood you get in a calendar year or have the blood donated by someone else. The benefit periods in original Medicare. A benefit period refers to the way original Medicare measures your use of hospital and SNF care. A benefit period begins the day you're admitted as an inpatient in a hospital or skilled nursing facility. The benefit period ends when you haven't gotten any inpatient care or skilled care in a skilled nursing facility for 60 days in a row. If you go into a hospital, a skilled nursing facility after one benefit period has ended, a new benefit period begins. You must pay the Part A inpatient hospital deductible for each benefit period, and there's no limit to the number of benefit periods you can have. Benefit periods can span across calendar years. So Part B, medical insurance, what does it cover? Part B helps cover medically necessary doctor services, services that are medically necessary, outpatient medical and surgical services and supplies for approved procedures like x-rays or stitches, for example, clinical laboratory services, blood tests, urinalysis, and some screening tests, durable medical equipment like walkers and wheelchairs and canes, and diabetic testing equipment and supplies. They also cover preventative services, many exams, tests, screenings, and some shots to prevent, find, or manage a medical problem, like flu shots and the yearly wellness visit. Medicare also covers many preventative services. These are healthcare to prevent illnesses or detect illnesses at an early stage when treatment is likely to work best. You pay nothing for most covered preventative services if you get the services from a doctor or the qualified healthcare provider who accepts assignment. However, for some preventative services, you may have to pay a deductible, co-insurance, or both. These costs may also apply if you get preventative services in the same visit as a non-preventative services. Talk to your healthcare provider about the services that are right for you. What you pay in original Medicare in 2022. In addition to premiums, there are other costs you pay in original Medicare. This is what you pay in 2022 for Part B covered medically necessary services, which are services or supplies that are needed to diagnose or treat your medical condition and meet the accepted standards for medical practice. The annual Part B deductible is $233 this year in 2022. If you have original Medicare, you pay the Part B deductible, which is the amount a person must pay for healthcare each calendar year before Medicare begins to pay. And this amount can change every year in January. This means you must pay the first $233 of your Medicare approved medical bills in 2022 before Part B starts to pay for your care. After you meet the annual deductible, you pay co-insurance for Part B services. In general, it's 20% for most covered services for providers accepting assignment. If the provider does not accept assignment, they can charge you up to 15% above the approved amount. It's called the limiting charge, and you may also have to pay the entire amount up front. As I mentioned before, most preventative services have no co-insurance, and the Part B deductible doesn't apply as long as the provider accepts assignment. You pay 20% for outpatient mental health services and visits to a doctor or other healthcare providers to diagnose your condition or monitor or change your prescriptions or outpatient treatment of your condition. What's not covered by Medicare Part A and B? Medicare doesn't cover everything. If you need certain services that aren't covered under Part A or Part B, you have to pay for them yourself, unless you have other coverage, including Medicaid to cover the cost, or you're in a Medicare Advantage plan that covers these services. Some of the items and services that original Medicare doesn't cover include most dental care, eye exams related to prescribing glasses, dentures, cosmetic surgery, massage therapy, routine physical exams, acupuncture or other types of acupuncture, or any condition other than the chronic low back pain, hearing aids and exams for fitting them, or long-term care. Let's talk a little bit more about prescription drug coverage, or Part D. Part D is a Medicare prescription drug coverage. It is an optional benefit available to all people with Medicare. If you choose original Medicare and you want prescription drug coverage, you must choose and join a Medicare prescription drug plan, or a PDP. You usually pay a monthly premium for the drug plan. These plans are run by private insurance companies that contract with Medicare. Part D coverage is provided through Medicare prescription drug plans and Medicare Advantage plans with prescription drug coverage. You can get Part D coverage through other Medicare health plans like programs, all-inclusive care for the elderly, such as PACE. However, each type of plan has special rules and exceptions. So you should contact any plans you're interested in and get more details. Better yet, call Connie Health to help you with those questions. How Part D works. Medicare contracts with private insurance companies that offer prescription drug plans to people with Medicare. Everyone with Medicare can get Medicare prescription drug coverage by enrolling in a Medicare drug plan. If you join late, you'll have to pay a penalty for as long as you have Medicare drug plan. You may get this coverage from a Medicare Advantage plan with prescription drug coverage, but to join a Medicare Advantage plan, you must have Part A and Part B. Each plan has a formulary of listed covered drugs. The formulary for each plan must include a range of drugs in most commonly prescribed categories. This ensures that people with different medical conditions can get the treatment they need. All Medicare drug plans generally must cover at least 2 drugs in each category of drugs, but plans can choose which specific drugs are covered in each category. All plans must cover a wide range of prescription drugs that people with Medicare take, including most drugs in certain protected classes. Medicare drug plan costs, what you pay in 2022. The cost for these plans can vary by plan. Most people would pay a monthly premium, varies by plan and income, a yearly deductible if it applies, co-payments or co-insurance, a percentage of costs while in the coverage gap, which begins at $4,020 for out-of-pocket spending. $4,430 for out-of-pocket spending this year in 2022, and very little after spending $7,050 out of pocket in 2022, and they automatically get catastrophic coverage. Part D late enrollment penalties. If you chose not to join a Medicare drug plan at your first opportunity, you may have to pay a late enrollment penalty in addition to your regular monthly premium if you enroll later. If you had other credible coverage, or if you qualify for extra help, you won't have to pay a late enrollment penalty. Medicare calculates the late enrollment penalty by multiplying 1% times the number of full uncovered months you didn't have Part D once you were eligible, or other credible coverage during coverage times the current national base beneficiary premium. This year in 2022, the base beneficiary premium is $33.37. The final amount is rounded to the nearest 10 cents and added to your plan's monthly premium. The national base beneficiary premium may change each year, so the penalty amount may also change each year. You may have to pay this penalty for as long as you have a Medicare drug plan. Your Medicare plan is required to tell you if you owe a penalty and what your payment will be. The late enrollment penalty goes to Medicare Trust Fund, not the plan. If you don't agree with your late enrollment penalty, you may be able to ask Medicare for a review or considerations. You need to fill out a reconsideration request form that the plan will send you, and you'll have the chance to provide proof that supports your case. Part D cost considerations. Each plan has a formulary. Check your prescriptions, make sure your prescriptions are covered, and compare the amount you'll pay. You may have lower out-of-pocket costs if you have access to and use a preferred pharmacy. You may owe a late enrollment penalty if at any time after your IEP is over, there's a period of 63 or more days in a row when you don't have Part D or other credible prescription drug coverage. The cost of the late enrollment penalty depends on how long you went without credible prescription drug coverage. Costs vary depending on the plan. All Medicare drug plans have to provide at least a standard level of coverage set by Medicare. However, some plans may offer more coverage and additional drugs, generally for a higher monthly premium. Who can join a Part D plan? To join a prescription drug plan, you must have Part A and or Part B. To join a Medicare Advantage prescription drug plan, you must have both Part A and Part B. And to join a Medicare cost plan with prescription drug coverage, you must have Part A and Part B, or have Part B only. If you get services outside of the plan's network without a referral, your Medicare covered services will be paid for under Original Medicare. Your Medicare cost plan pays for emergency services or urgently needed services. Each plan has its own service area in which you must live to enroll. Most people must join a Medicare drug plan to get coverage. So while all people with Medicare can have this coverage, you need to take action to get it. If you qualify for extra help to pay for your prescription drugs, Medicare will enroll you in a Medicare drug plan unless you decline coverage or join a plan yourself. You can only be a member of one Medicare drug plan at a time. Who can enroll in a Part D plan? You can join a Medicare drug plan during your 7th month initial election period, or your IEP. Your IEP begins 3 months before the month you turn 65 and includes the month you turn 65 and ends 3 months after the month you turn 65. The yearly annual enrollment period, this is the period from October 15th through December 7th. Any eligible person can join, switch, or drop a Medicare drug plan during this time. Each year, you have a chance to make changes to your MA or Medicare prescription drug plan for the following year. Your coverage starts January 1st. For most people, this is a one-time each year that changes can be made. If you make a change during this time, your new coverage starts on January 1st. If the plan gets your request by December 7th. If you don't have Part A coverage and enroll in a Part B during the Part B general enrollment period, which is January 1st to March 31st, you can sign up for a Medicare prescription drug plan from April 1st to June 30th, and your coverage will begin on July 1st. Generally, you must stay enrolled for the entire calendar year. However, in certain situations, you may join at other times. Like if you switch from a Medicare Advantage to original Medicare during the Medicare open enrollment period, you may add Part D coverage. The Medicare open enrollment period is from January 1st to January 31st each year. Your coverage begins the first day of the month after you enroll in the plan. You must be enrolled in an MA plan during the first 3 months of the year to use this enrollment period. Also, if you're new to Medicare and you're enrolled in an MA plan during your initial election period, you can make a change within the first 3 months you have Medicare. So decisions to make. Should you enroll in a Part D plan? Everyone with Medicare has to make a decision about prescription drug coverage. If you're new to Medicare and already have other drug coverage, like from an employer or union, find out how your employer or union drug coverage works with Medicare, because your coverage may change if you join a Medicare drug plan. Your employer or union will send you a credible coverage disclosure each year, letting you know if it's considered credible prescription drug coverage and how it compares to Medicare drug coverage. If you don't get this information, make sure to ask your employer or union for it. You may have to make choices about your employer union drug coverage and the Medicare drug coverage. During your 7th month initial enrollment period, when you first become eligible for Medicare, during your open enrollment between October 15th through December 7th each year, or when your employer union coverage changes or ends. Before making a decision, you should consider if your employer or union drug coverage is credible. If not, in most cases, you'll have to pay a late enrollment penalty if you don't join a Medicare prescription drug plan when you're first eligible. If you or your spouse or dependents will lose all of your employer or union health coverage if you join a Medicare drug plan, also consider how your out-of-pocket drug costs with your employer or union drug coverage compares to the out-of-pocket costs with the Medicare drug plan. Also, how will your costs change if you get extra help with your Medicare drug plan cost? If you decide not to join a Medicare drug plan when you're first eligible and you don't have any other credible prescription drug coverage, or you don't get extra help, you will likely pay a lifetime late enrollment penalty if you join a plan later on. Let's talk a little bit about Medigap policies, also known as Medicare supplements. A Medicare supplement insurance policy, or Medigap policy, is health insurance sold by private insurance companies to help fill gaps in original Medicare coverage. Medigap policies can help pay your share, which includes co-insurance, co-payments, or deductibles of the cost for Medicare covered services. Some Medigap policies also cover certain benefits original Medicare doesn't cover, like medical care if you travel outside the US. Medigap policies don't cover your share of the costs under other types of health coverage, including Medicare Advantage plans, standalone prescription drug plans, group health plans, like from an employer or union, Medicaid, Veteran Affairs, VA benefits, or TRICARE. All Medigap policies cover a basic set of benefits, including the following. All plans pay 100% of Part A coinsurance and hospital costs. Plans A, B, C, D, F, G, M, and N pay 100% of the Part B coinsurance or copayment. Plans A, B, C, D, F, G, M, and N pay 100% of blood, the first few pints. Plan A, B, C, D, F, G, and M, and N pay 100% of Part A hospital care coinsurance or copayments. In addition, each Medigap plan covers different benefits. Make sure to reach out to Connie Health and speak to a licensed agent to go over this in greater detail. A decision that needs to be made. Do I need a Medigap policy? Things to consider is a Medigap policy only works with the original Medicare. Medigap doesn't work with the Medicare Advantage plan. If you have other coverage that supplements Medicare, like retiree coverage, you may not need a Medigap policy. Consider whether you can afford Medicare deductibles and copayments, and weigh this against how much the monthly Medigap premiums cost. When is the best time to buy a Medigap policy? Usually the best time to buy a Medigap policy is during your Medigap open enrollment period, your OEP. It begins the first day of the month in which you're both 65 or older and enrolled in Part B. You must also have Part A to have a Medigap policy. You have 6-month Medigap OEP, which gives you guaranteed right to buy a Medigap policy. And some states may have a longer period. Once this period starts, it can't be delayed or repeated. During your Medigap open enrollment period, companies can't do the following. They can't refuse to sell you a Medigap policy they offer. They can't make you wait for coverage to start. There can be a waiting period for pre-existing conditions if you don't have credible coverage. Previous health insurance coverage that can be used to shorten the pre-existing condition waiting period under Medigap policy before the OEP. They can't charge you more for a Medigap policy than they charge someone with no health problems. And you may want to apply for a Medigap policy before your Medigap OEP starts if your current health insurance ends the month you become eligible for Medicare, or you reach 65 to have continuous coverage without any break. Quick note here is after your Medigap open enrollment period ends, you may be denied a Medigap policy or charge more for a Medigap policy due to past or present health conditions. However, there are exceptions if you have employer coverage. You can also buy a Medigap policy whenever a company agrees to sell you one. However, there may be restrictions like medical underwriting or a waiting period for pre-existing conditions. Medical underwriting is a process by insurance companies to determine your health status when you're applying for health insurance, whether to offer you coverage, at what price, and with what exclusions or limits. Now let's talk more about Medicare Advantage plans or Part C. A Medicare Advantage plan is another way to get your Medicare coverage. These plans are sometimes called Part C or MA plans, and they are offered by Medicare-approved private companies that must follow the rules set by Medicare. If you join a Medicare Advantage plan, you'll still have Medicare, but you'll get your Part A, hospital insurance, and Part B, medical insurance coverage through the MA plan, not original Medicare. In most cases, you'll need to use healthcare providers who participate in the plan's network. Some plans offer out-of-network coverage. How Medicare Advantage plans work. If you're in a Medicare Advantage plan, you are still in Medicare with all the rights and protections. You still get services covered by Part A and Part B, but the MA plan covers those services instead of original Medicare. And again, you must have both Part A and Part B to join a Medicare Advantage plan. And you may choose a plan that includes prescription drug coverage, and you can be charged different out-of-pocket costs depending on the plan, but you can be charged more than the original Medicare for certain services like chemotherapy, dialysis, and skilled nursing facility care. You may choose a plan that includes extra benefits like vision, dental, or fitness and wellness benefits offered at the plan's expense, and these services are usually not covered by Medicare. And you usually have a yearly amount on your out-of-pocket cost as well. Quick note about Medicare Advantage plans. MA plans can also cover extra benefits than they have in the past, including services like transportation to doctor visits, over-the-counter drugs, adult daycare services, and other services that promote your health and wellness. Plans can also tailor their plan offerings to people with certain chronic health conditions. More details about these benefits are available by calling Connie Health and speaking to a licensed agent. How Medicare Advantage plans work continued here. Each plan has a service area in which its enrollees must live. You can request to see if an item or service will be covered by the plan in advance. Sometimes you must do this for the service to be covered. This is called an organization determination. Contact the plan for more information. Medicare pays a fixed amount for your coverage each month to the companies offering MA plans. Each Medicare Advantage plan can charge different out-of-pocket costs and have different rules for how you get services, like whether you need a referral to see a specialist, or if you have to go to the doctors, facilities, or suppliers that belong to the plan's network for non-emergency or non-urgent care. These rules can change each year. Hospice care is covered if you're enrolled in a Medicare Advantage plan, but it is covered by original Medicare. When can you enroll in a Medicare Advantage plan? You can join a Medicare Advantage plan when you first become eligible for Medicare, generally during your initial enrollment period, which begins 3 months immediately before your first entitlement to both Part A and Part B. If you have Part A and enrolling in Part B during a general enrollment period, you can enroll in a Medicare Advantage plan from April 1st to June 30th with coverage starting July 1st. You can also enroll using a special election period or an SEP in certain circumstances, like if you move out of your plan service area, you have or lose Medicaid or extra help, move in and out of an institution like a nursing home, If it's a 5-star special election period, you can switch from one Medicare Advantage plan or a Medicare cost plan that has 5 stars for its overall star rating. Or you can wait to the annual enrollment period, which is from October 15th through December 7th each year. When can you enroll in a Medicare Advantage plan continued? Again, each year you have the chance to review your Medicare coverage and you can join, switch, or drop your plan. And this is again through the annual enrollment period, which lasts from October 15th to December 7th of each year. And your coverage will begin on January 1st, as long as the request is made by December 7th. The Medicare open enrollment period allows people enrolled in a Medicare Advantage plan to make a one-time change during the first 3 months of the calendar year, January 1st through March 31st, to switch Medicare Advantage plans or to drop a Medicare Advantage plan and get coverage through original Medicare. Coverage begins the first of the month following enrollment, and you must be enrolled in a Medicare Advantage plan during the first 3 months of the year to use this enrollment period. Also, if you're new to Medicare and you're enrolled in a Medicare Advantage plan during your IEP, you can make a change within the first 3 months you have Medicare. In addition, people newly eligible for Medicare Advantage who enroll in a Medicare Advantage plan also have an opportunity to make a one-time election to change Medicare Advantage plans or drop MA coverage and get original Medicare, which is called the trial right. However, if you drop a Medicare Supplement insurance policy to join a Medicare Advantage plan, you might not be able to get it back, and rules can vary by state and situation. Always speak to a licensed agent to make sure you get all the correct information regarding these situations. So should you join a Medicare Advantage plan? Some things to consider here. You should consider that you have to, in order to join a Medicare Advantage plan, you must know that you must have Part A and Part B to join. Most plans offer comprehensive coverage, including Part D drug coverage, and some plans may require you to use a network, and you may need a referral to see a specialist, and you must pay the Part B premium and usually a monthly plan premium. You can only join or leave during certain periods, and MA plans don't work with Medigap policies. So can I join a Medicare Advantage plan if I have end-stage renal disease? Starting January 1st of 2021, people with end-stage renal disease may join a Medicare Advantage or Medicare Advantage prescription drug plan without the restrictions listed on this slide. And people can use the 2022 open enrollment period to enroll in a plan. Benefits will start on January 1st of that following year. So how are Medigap policies and MA plans different? The chart displays a side-by-side comparison of how Medigap policy and MA plans differ. Both are offered by private companies. A Medigap plan must follow federal and state laws, but routine day-to-day oversight of standardized Medigap plans is the state's responsibility. MA plans must be approved by Medicare. Medigap policies only work with the original Medicare. They don't work with MA plans. If you join an MA plan, you can't use a Medigap policy to pay for the out-of-pocket costs you have in the MA plan. Original Medicare pays for many, but not all, healthcare services and supplies. Private insurance companies sell Medigap policies to help pay for some of the out-of-pocket costs or gaps that original Medicare doesn't cover. Medigap policies don't pay your Medicare premiums. Most Medigap policies don't cover out-of-pocket drug expenses. If you want prescription drug coverage, you need to consider joining a Part D plan. Some older policies, not long or so, may have included some prescription drug coverage. In both cases, you must have Part A and Part B to buy a Medigap policy. You pay a premium for a Medigap policy or an MA plan, as well as a Part B premium. And if you already have an MA plan, it is illegal for anyone to sell you a Medigap policy unless you're disenrolling from your MA plan to go back to original Medicare. Other Medicare special enrollment periods, or SEPs. You may be able to join or switch plans outside the open enrollment if any of these special circumstances apply to you. You move out of your plan service area. You have Medicaid and Medicare, sometimes called dual eligible or qualify for low income subsidies, also known as LIS. You make an election within 3 months after a gain, loss, or change to Medicaid or low income subsidy, or a notification of such a change, whichever is later. You can also have a special election period if you're enrolled in a plan that decides to leave the Medicare program or reduce its service area, or you leave or lose employer or union coverage, or you enter, live at, or are leaving a long-term care facility like a nursing home. And there's plenty of other exceptional circumstances. Again, it's important to speak to a licensed agent to go over your personal situation to determine if you qualify for a special enrollment period, and you can call us here at Connie Health for help. Help for people with limited income and resources. There are programs available for people with limited income and resources to help pay for the healthcare and/or prescription drug costs. These include the Medicare savings programs, Extra Help, Medicaid, and Medicaid. You should apply for these programs if you have limited income and resources. Even if you aren't sure you qualify, you should apply. Medicare savings programs. These programs provide help from your state to help pay Medicare costs, including Medicare premiums, deductibles, coinsurance, and copayments. It often has higher income and resource guidelines than full Medicaid. Extra Help. This program helps people with limited income and resources and the cost of Medicare prescription drug coverage. It's also called the low-income subsidy. Some people with Medicare must apply for Extra Help, and you can apply by filling out a paper application or applying at socialsecurity.gov, or better yet, calling a licensed agent at Connie Health to help you with the process. Also, Medicaid is available. This program helps pay medical costs for some people with limited income and resources. It's jointly funded by federal and the state governments, and it's administered by each state. What is Extra Help? Extra Help is a Medicare program to help people with limited income and resources pay Medicare prescription drug costs, like premiums, deductibles, and co-insurance. If you have the lowest income and resources, you'll pay no premiums or deductibles and have small or no co-payments. If you have slightly higher income and resources, you'll have a reduced deductible and pay a little more for out of pocket. If you qualify for Extra Help, you won't have a coverage gap or Part D late enrollment penalty. And that concludes our Medicare 101. We will be moving to our Q&A session next. We'll see, we're getting some questions here. Just one moment. All right, let's go ahead. I think we got our first question in the chat box here. Let's see here. The first question is, what will Medicare cost me when I join? Great question. Medicare Part A is usually free, and the Medicare Part B standard premium this year for 2022 is $170.10 per month. The amount that you pay for your Part B premium depends on your income, so you should have a licensed agent review your plan, and this will give you more of an understanding regarding your personal situation. All right. Next question here. What is a special enrollment period? Good question again. A special enrollment period, also known as an SEP, is when you can make changes to your Medicare Advantage and Medicare prescription drug coverage when certain events happen in your life. This could include moving, if you lose other insurance coverage, and other situations. And there's certain rules about when you can make changes, and the type of changes you can make are different for each special enrollment period. If you're curious to see if you qualify for a special enrollment period, you should speak with an agent and call us today. And that number is 1-888-878-6064 to see if you qualify. Okay, we got another question coming through here. Question is, do I need to sign up for Medicare if I'm not retiring this year? Another great question here. It depends on how you get your health insurance now and the number of employees that are in the company where you or your spouse work, okay? So generally, if you have job-based health insurance through your or your spouse's current job, you don't have to sign up for Medicare while you or your spouse are still working. You can wait to sign up until you or your spouse stop working, or you lose your health insurance, whichever comes first. Let's see here. Next question. How can I check to see if I'm eligible for Medicare? To find out if you're eligible for Medicare and your expected premium, it would be great if you just call us here at Connie Health. And that number again is 1-888-878-6064. And you can speak to one of our local agents and they can help you determine if you're eligible for Medicare. We have the tools necessary to look that up for you. So you can give us a call. Again, that's 1-888-878-6064. And again, you can speak to one of our licensed agents and they can guide you through the entire process. Next question, what what is covered under Part A and Part B and our prescriptions included. As we mentioned earlier in our presentation, Part A is going to cover your inpatient care in a hospital, which includes semi-private rooms, your meals, general nursing, any medications that you're going to be taking, your first 3 pints of blood, hospice care, and home health care as well. Your Part B is more for your medical. It's going to cover your doctor services, outpatient medical and surgical services and supplies, clinical lab tests, durable medical equipment, and even things like diabetic testing equipment and supplies, and also preventative services like your flu shots. Prescriptions are not included under original Medicare, and you will need to purchase a separate prescription drug plan or sign up on a Medicare Advantage plan that offers prescription coverage. All right, is a Medicare Advantage HMO or PPO plan better for me? That's a really good question. There's no right choice for everyone, okay? I think instead Medicare Advantage beneficiaries should review the terms of specific plans available in their area. HMOs typically have lower monthly premiums, though fewer clinicians will be covered, and this can be a problem if you are selective about your doctors or a doctor you like is not in network. PPOs generally offer a wider variety of clinician choices, but you may pay a higher premium or higher monthly premiums and higher copays. And if you choose to seek care out of network, you usually pay more. Again, it's just going to come down to preference and what your situation currently is. And again, by speaking to one of our licensed agents, they can help determine what might be the best route for you. For those of you who just joined, again, I'm Sid Martinez. I'm a licensed agent and general manager here at Connie Health with over 10 years of Medicare experience. If you have any questions, please add them in the comments here in the chat box, or you can always just call us to speak to an agent at 1-888-878-6064. All right, let's continue with your questions. We have time for a few more. Next question, are dentures covered by Medicare? So Medicare doesn't cover most dental care, dental procedures, or supplies like cleanings, fillings, tooth extractions, dentures, dental plates, or any other dental services. However, some Medicare Advantage prescription drug plans may offer additional coverages like dental services, which include coverage for for dentures. You call and speak to one of our agents today, so we may help you find a suitable plan for you in your area. Next question. How can I find a plan that takes my doctors and prescriptions? Excellent question. Connie Health's advanced technology simplifies the selection process. We use an unbiased plan approach based on the information you give us. We're looking for the doctors that you prefer, the medications that you take, and the benefits that are most important to you. So please give us a call so we can help you sort through all the plans in your area and focus on those preferences. Again, that number is 1-888-878-6064. What should I consider? Next question here is, what should I consider when choosing a Medicare Supplement or a Medicare Advantage plan? I think the things that you need to consider are your lifestyle, your health condition, and finances. And this may all have an influence about what's going to be determined be best for you. Traditional Medicare plus Medigap or Medicare Advantage. And here's some things to consider. The cost, Medigap plans have additional premiums, and Medicare Advantage prescription plans may or may not have premiums. The choice of doctors that you're looking to see, your overall health, and if you're looking for broader health benefits. All right, here. I think we have time for a couple more questions here. Does Medicare cover hearing aids? Original Medicare Part A and Part B does not cover hearing aids in 2022. If you have a Medicare Part A or B plan, you still need to pay for your hearing aids out of pocket, or if you have other insurance. However, there are Medicare Advantage prescription drug plans in your area that may cover them. Just call us to find out which plans may cover them if that's something that's important to you. Does Medicare pay for nursing homes? Medicare generally doesn't cover long-term care stays in a nursing home. Even if Medicare doesn't cover your nursing home care, you still need Medicare for hospital care, doctor services, and medical supplies while you're in the nursing home. So most people who enter nursing homes start by paying for their care out of pocket. All right, I think we have time for one last question. I'm enrolling in Medicare for the first time. Are there any specific steps I should take to prepare for a meeting with an agent? Absolutely. I think coming prepared with as many questions that you may have regarding your Medicare and benefits. Come with the list of your preferred clinicians, doctors, specialists that you like to see or continue seeing, a current list of your medications that you take, and also if you have your Medicare card available, if you have it, that would also be very helpful. All right, folks, want to thank you for joining today's live Medicare 101. I appreciate your questions and hope that we were able to help. Connie Health is a no-cost service that gives you unbiased recommendations from local licensed agents. And we use advanced technology to sort through all the plan options in your area to find the one with the doctors and medications that you need and care about. Connie Health can help you navigate your Medicare journey. You can call to speak with the local licensed agent at 1-888-878-6064. Again, that number is 1-888-878-6064. And we look forward to answering your questions at our next live Medicare 101. Thank you so much.